Hi everybody, this is Sharon Parlia. Today we're going to talk about actually the steps to implementing an EMR. This is a very large topic, so I broke it up into two parts. So today we're going to talk to Module 10, and this will be part 1 of steps to implement an EMR. Stay tuned. So as an overview, I just want to discuss briefly the steps to implement an EMR. I will go into each of these steps in greater detail, but I just want to give you an overall of what we're going to be talking about during this module. So the first step will be to assess your practice's readiness. How ready is the office to receive an EMR and implement an EMR? Next, we have to plan your approach. You have to have a plan. To do anything to be successful, you need a plan. Thirdly, we're going to select or upgrade to a certified EMR. This is very important, especially for meaningful use, because in order to achieve meaningful use, you must be on a certified EMR. It's one of the bases for meaningful use. Next, we want to conduct training and actually do the implementation of the EMR. This is very complex. We want to make sure everyone's on board, everyone's trained properly, and we want the system running as intended. Next, we want to achieve meaningful use. Of course, we want better patient care, but another reason for implementing an EMR is to achieve meaningful use, not just for the financial reasons. There is a financial benefit to achieving meaningful use, especially the first few years, but it is a government regulation and will be a government regulation moving forward. So it's a win-win for all parties to achieve meaningful use. And lastly, we want to continue quality improvement. We always want to improve quality in healthcare, and this is one way we can help and do that. So to begin with, we need to assess how ready the practice is to implement an EMR. The assessment phase is the foundation to all other implementation steps relating to the EMR. And it involves determining if the practice is in fact ready to make the change from paper records to an electronic health record, or to upgrade from a current EMR they might be on to a new certified version. So in a nutshell, what the assessment phase does is it looks at current state. How are things running today? How's the office running? Whether it's on paper or electronically, there's always room for improvement, and there's often change involved. Not necessarily bad change, but change is change. So we need to map out exactly how we're doing things today. Sometimes it's eye-opening to the practice to see on paper, when it's written down, how they flow, and you can then see where there's room for improvement and optimization to make the flow better. While doing this assessment to see if we're ready to implement an EMR, there's questions we need to ask ourselves and of our staff. For instance, are clinical workflows efficient and understood by all staff? Are administrative processes organized, efficient, and documented? Are data collection and reporting well documented? Are staff members computer literate? Maybe they need to take a computer class before we can even start this project. Is there access to high-speed connectivity? Is the network in place? Do we have all the, backbone, the hardware that we need? Again, does the practice have access to financial capital to purchase new hardware? Often when you implement an EMR, there's equipment that goes along with the cost. It's not just software, not just the application, but the hardware to run it. Are there specialty-specific requirements? And also, are there clinical priorities or needs that need to be addressed? There's many questions that need to be asked, and it's good to ask them early on. Along with asking all the questions and assessing whether the office is ready, we also want to plan, for what outcomes we're hoping to achieve. We want to also envision the future. What will be different for the patients? What will be different for the providers? What will be different for the staff? We want to have outcomes. We want a leadership team with strong advocates for the change. We want to have a unified implementation vision and roadmap. And as well, we want measurable goals. In order for a project to be successful, you need goals, and they need to be measurable and attainable. Talking about goals, they need to be specific. You want to achieve goals that would make a difference for your patients and your practice. They need to be measurable. You want to be able to quantify the current level and the target goal. They should be attainable. Although the goal may be a stretch, you can achieve it. And the goals should also be relevant. It's worth the effort. And lastly, they should be time bound. There has to be a deadline. In any project, there needs to be a beginning and an end. So again, with any project, you need a plan. It's very important to plan your approach. First thing I want to talk about is clarifying and prioritizing. What new tasks or processes are we going to start doing? What tasks and processes are we going to stop doing? And what tasks and processes are we going to sustain? Whenever you plan, you have to be very clear, and you also have to prioritize what you're doing, when you're doing it, what's going to be new, what's going to be removed from the whole picture. Okay, now let's talk about the actual steps involved in planning the implementation of an EMR. First, we need to determine the current state. We want to map out current workflow processes. It's good to analyze and map out the current workflow and processes of how the practice currently gets work done. The current state, we call this. Next, we want to determine future state, new workflows to reduce inefficiency and duplicate processes. You want to see what it's going to look like. You want to create new patterns to improve, possible inefficiencies that exist today. Next, we want to create a contingency plan, or as we call it, a backup plan, to combat issues that may arise throughout the implementation process. Let's face it, not everything goes perfectly, so sometimes you need to have a backup plan or a back out plan, to moving forward. Next, we want to create a project plan and someone to manage the project. Whenever you plan a project, you need a project plan. You need to be able to whether it's transitioning from paper to an electronic medical record or upgrading, you need a plan, and you need someone in charge to manage the plan. Continuing along with the steps in planning is creating a chart abstraction plan. A means to convert or transform information from paper charts to electronic charts. We want to identify specific data elements that will be entered into the new electronic medical record, and if there are items that will need to be scanned. We need to understand what data elements will be brought in and how we're going to do this. This is very important. Next, we want to identify privacy and security issues. Often there's concerns regarding privacy and security, and we need to plan and address them. It's essential to emphasize the importance of privacy and security when transitioning to electronic medical records. This is a big concern for all. And next, we actually have to go about the business of selecting an EMR. How do you do this? Where do you even start? Some processes that have been followed are to do site visits. I know in the past, I've been involved in selecting EMRs, and we've gone to different sites where they've been in use, so you could see how they're working and get feedback from the people using them. You also want to develop and distribute a request for proposal, an RFP. So the proposal goes out. Obviously a big important factor is cost. You want to get the most for your money. Next, once the proposals come back, you need to review them. Maybe make up a spreadsheet, so you can compare apples to apples on each item that's important to you. In addition to the site visits, it's good to have some of the vendors come, to your site and do vendor demonstrations. You're going to see all the bells and whistles, but it's nice to see what's available, because often after you do an implementation, you want to then optimize and do all the bells and whistles that it's capable of doing. You want to also review specialty-specific functionality, and general usability. Something that works for an orthopedic office may not work for, a gynecologist office, just different functionality. So you want something, that integrates maybe to where your patients, the hospitals your patients go to, but you also want it, to have the functionality specific to your office. Again, you want to be able to clearly identify hardware and any IT support requirements. Sometimes you need additional resources when doing an implementations. Sometimes the software company provides these resources. They provide a project plan. So it's something to keep in mind. You also want to rank the EMRs or EHRs and compare the functionality, usability, and pricing. Again, I usually use a spreadsheet, something where you can visually compare side by side, how each one ranks. Next, once you do pick one of the EMRs, you want to negotiate contract and licensing agreements. How long, is the license for? What's the maintenance? There's a lot of factors to keep, in mind. And lastly, hopefully you will purchase a solution and the correct solution for you and for your office.